Wikidonist.com. Truth about tooth.
We've been talking about bad habits and the effects that is caused due to the bad habits on dental tooth or dental tissues and tooth by in itself. There are problems that can cause cancer and other precancerous lesion, which is actually your smoking or using of all these intoxicants like all this pan chewing and stuff, which has a lot of arecanut in it, which has a lot of tobacco in it. It can go for cancer and things like that. But today's topic is basically about treatments, which is not including all this cancer treatment and things like that, but it is about how to correct all these problems due to tongue thrusting and other dental issues. So now, what happens, I'll start with the smoking itself. See, one of the major reasons why people come to the dentist is basically to remove all the smoking stains and things like that, so that the teeth looks whiter and brighter. Along with that, there is, so that can be cleaned up, and maybe we can do a bleaching or stuff like that so that it looks much whiter and things like that. But most of the time this will also have periodontal issues, or the supporting structures like the gums and the bone can get lost, or it can get reduced because of the nicotine which is present in the smoke itself. So more than the stains which is actually happening, the gums can get receded. All this, the healing process of the gums and the surrounding tissues can get altered because of the heat, and second thing is the nicotine which is present there. So what you have to do is you have to stop the smoking as early as possible. If you can quit the smoking, because as I told in the last Malayalam video, I will tell you in this also, you cannot smoke unless you go and buy the cigarette. You have to light the cigarette and you have to keep it in your mouth. So it is all about having a fire on one end, the food on the other end, because you are actually destroying your own health by having a cigarette in your mouth. So please stop smoking so that you will get a better smile, and second thing is you will have tooth to chew on. Even if you have lost the tooth and you have kept an implant, that also can get lost because of the smoking. So please stop it. Now about pan chewing. Pan chewing, it causes a lot of vertical dimension loss, or it gets the back teeth gets grounded off. I have been talking about it last time. So what happens is, if we have been chewing pan for quite some time, if you have lost the vertical height, you will get all crevices and you will get all the aging lines and things like that. So we can actually correct it by increasing the vertical height using a crown and things like that. If it is not that bad, then we can still correct your stains and things like that with a plain scaling, or you can actually use a bleaching stuff or whitening stuff to reduce the color, correct the color of the tooth. If it is so intrinsic, if you have used some very bad chemicals for your pan chewing and stuff, then you might have to go for crowns, even though you might have not lost the vertical height, at least in the front. So that is one part of it. If you have tongue thrusting, see, tongue thrusting is another habit which can cause the open bite. I have been talking last time. The tongue thrusting has to be corrected by taking a small glass of water and doing the swallowing in the right way. How do you do that? The tip of the tongue has to touch the palate only. It should not touch the back side of the tooth when you swallow. So you take a small glass of water, take little by little sips and swallow correctly. So if you can do it around 20 to 40 times a time, and if you can do it for 3 times a day for next 30 days, you will learn how to swallow correctly. Then what happens, the tongue thrusting will not happen, and then your teeth will slowly move back and also close the open bite. So that is the treatment. If you are not able to do that, if you are still having trouble with that, then we will have to go for something called as a tongue crib or a palatal crib or a palatal guard, wherein you will be reminded of the same problem, and then you can, and it will not allow the tongue to cross and touch the tooth. So that will help you to reduce the open bite and things like that. So that is also one way of doing it. Now the other problems are actually having, I have been talking about needles, you might be using a wind instrument and things like that. You might lose the chip or chip the enamel because of some bad habit, like opening of cans or opening of Pepsi bottles or whatever you are using, or a sauce bottle, or using wire tooth to do the peeling of wires and things like that. If you are doing such stuff, please stop it. Second thing is, you can actually correct it using if you have lost some enamel or notched somewhere, then we can actually use a nano ceramic or a composite filling to do that notching correction. Or if you have lost a lot of enamel, then we can still go for a crown or a veneer to correct the tip and correct the smile properly. So these are some of the things. If you are a nail biting person and if you have pushed the teeth inside, then you'll have to go for orthodontics to get it corrected, or you can go for clear aligners and correct it off. But with all these things, let me tell you and reiterate to you that you should stop the habits by relearning or unlearning and learning the whole process, how to do it properly, how not to do something like nail biting or smoking or have pan chewing. Replace it with something which is useful and healthier, and you can actually come out of it. Please don't tell that, oh, I'm not able to do it. So that's not an answer to your problem. You should stop whatever you are doing and then learn how to keep your teeth properly, how to keep the avoid all these things by using the right material. If you are a person who is working in the electrical field or electronic field, buy your tool, use the tool proper to crimp your wires and use the to peel the wires and things like that. Please use the right tool so that the work will be much better, the teeth will be much better, you will be able to smile, you will be able to have more healthier teeth in your mouth. And please make sure that, don't think that just because you have been using your tooth to open the bottles, it doesn't mean that there is no crack on the tooth. It will crack one day or the other. So please make sure that you stop all these things. It is not great to have broken teeth, and having chipped teeth and bad smiles is not at all welcome. Although you might be a hero for a day, you might be losing a lot of money for correcting all these chipped and broken and infected teeth and things like that. So please break your habit, but develop good habits so that you will have a better smile, whiter smile, and also have great friends so that you will learn better habits and you will use the time properly. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental. If you have not heard any of my videos, please go back and look into my videos, because there are a lot of videos about dentistry, different treatments, what all are the specific treatments for different problems. And if you have a problem and if you would like me to do a video on it, please comment on this so that I will be able to talk about it in the next videos to come. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental, signing off.
Wikidonist.com. Truth about tooth.